some disturbing news tonight about the possible spread of SARS.
14 healthcare workers at Scarborough Grace Hospital are showing symptoms of SARS. Most of those infected are nurses.
Ona faced down its biggest and most dangerous health and safety challenge ever in the tragic outbreak of SARS in 2003.
They are the nurses, custodians, technicians, and lab workers on the front line of Ontario's battle against SARS.
We're here to look after our patients.
But in caring for others, workers themselves became infected with the illness. Some died.
I think the hardest part about that period of time was one day you'd be working with staff and the next day that same staff would be your patients.
Ona demanded safe masks and strict hospital procedures to halt the spread of SARS.
The Ontario Nurses Union says most of the people being monitored are nurses, and it's demanding more protection for its members, such as double gloves and masks.
In Canada today, health officials say another person has died from the SARS virus in Toronto, the country's largest city. The death toll there is now 30. In the last 10 days, there have been 43 probable cases.
Tonight, there are suspicions, even accusations that hospitals let down their guard.
There are more troubling reports that nurses at North York General, where the new cluster of cases began, warned of a problem, but were ignored.
They warned officials on May 20th that there were suspected cases. The warnings weren't heeded.
The nurses raised the issue at both North York and St. John's, and they were told that there was an investigation ongoing. And what they would have preferred to see was have the isolation measures reinstituted at that time, and it would have been 2 days that people would not have been exposed.
The nurses are frustrated at that. They feel patients, their own colleagues, and the public at large were put at risk. The frontline nurses are not being listened to sufficiently. The number are saying, we're not going to continue. We just can't do it a second time.
They're quitting?
They're resigning, they're reportedly resigning because they can't face another go-around.
There can also be deep emotional and psychological effects. A study found that some healthcare workers infected with SARS reported fear, depression, and anxiety.
You don't sleep, you worry about your mates, you worry about, am I exposing my family? Do I have enough protection?
The emphasis of this demonstration is on safety. They want new, consistent rules that ensure that they aren't infected with SARS. That, and they want the government to put more resources into the hospitals. Resources translates into more healthcare workers.
Ona was everywhere in the media, and the public demonstrated its support for frontline nurses. Ona was an important contributor to the SARS inquiry and later demanded action by the government.
Ontario is now no more prepared for the outbreak of an infectious disease like SARS than it was last March or June.
On behalf of the nurses that had contracted SARS and their families, Ona launched a lawsuit against the government.